So, uh, good evening, viewers. This special edition of Cypher Health News is being released on World Hemophilia Day, which is about bringing the global bleeding disorders community together. With the COVID-19 pandemic having a major impact on people with the bleeding disorder, that objective has never been more important. The world has changed greatly over the last year, but one thing hasn't, that we are still in this together. So I'm Dr. Rakesh Gupta. I'm President and Director of Public Health Strategic Institute for Public Health Education and Research, and a former Director of Services and Director of Chemical Examiner Lab in Punjab. And Dr. Sonu Goyal, he is with me. He is Professor in Department of Community Medicine and School of Public Health, PGIMA at Chandigarh. And he is also Program Director for International Public Health Management Development Program. It is sponsored by Ministry of External Affairs, Government of India. So, dear viewers, I welcome you all for this very special edition of Cypher Health News. This coincides with the World Hemophilia Day, 17th April 2021. And it is my proud privilege to introduce Dr. Vineeta Gupta. So Dr. Vineeta Gupta, she's a maternal and child health physician, human rights lawyer, and a passionate activist for health equity. She has over 20 years of experience in supporting projects in more than 40 countries. She is a former director at Global Health Advocacy Incubator, leading their work on resolve to save lives. As technical director, Global Women's Health at American College of Obstetricians and Gynecologists, and senior technical advisor at University Research Company, she has led USAID-funded projects globally to strengthen the maternal and newborn capacity. She consults on partnerships and capacity building, including strategy, fundraising, and maternal and child health capacity strengthening. She developed curriculum and adult training materials for basic, emergency, obstetrics, and newborn care. She also has authored many advocacy and clinical capacity building materials, including professional association, strengthening modules, and complicated labor and birth modules.
In addition to RMNCH, Organizational Development Fostering Partnerships, Dr. Vineeta has conducted many workshops on diversity, inclusion, equity, and health disparities, and has been invited to speak in over 60 universities in United States and Europe. She has successfully built multi-sectoral collaborations engaging diverse stakeholders to achieve results. She received the Rotary Service to Humanity Award 2001 in recognition to her work in human and health rights. She is widely covered in print and online media and TV globally, including Washington Post, The Economic Times, The Hindu, Times of India, Hindustan Times, Indian Express, National Public Radio, CNN, Voice of America, and many others. She obtained a master's degree and a law degree in India and graduated magna cum laude with a master's degree in international human rights law from Notre Dame University in United States.
So, Dr. Vineeta, we welcome you to this informal talk with us. And we'd like to know first about your early college life and your parents.
Thank you, Dr. Rakesh. First of all, let me congratulate you on this great initiative that you have to motivate young people. We need them. We definitely need them to continue this marathon towards public health goal achievement. So, and the second one, I want to thank you for having me for this call, to be able to share my thoughts, especially with you two there from my old medical school, Government Medical College, Patiala. And it just connects me to all that time that we spent in the college learning and sometimes not learning so much. So thank you so much for giving me this opportunity. So my college life and my parents. It's interesting. I grew up in this household and family that each generation had its own passion. My grandfather was very passionate about girls' education. So he founded the first girls' private school, Arya Smart School, for girls' education. And my father was in human rights, so very civil, political, active. And I became more into socioeconomic and health rights. And so each generation has its own passion in our family and robust discussions. And I grew up with this opposing ideas, and it's okay to have heated discussion on the dining table, and it was fine. So that's how I grew up in, and interestingly, that's how my mom and dad met. I don't think I've shared that with publicly on that. So my grandfather had the school, and he wanted to bring the science education to the girls in Bathinda city in Punjab. It's kind of a township between many rural areas draining into it, very hub of the farming community, a township. So it was his wish to start science education. So my mom's father was also involved in freedom fighting movement in India. So they kind of met on one Arya Samaj conference in old times in 50s. And he talked about like, oh, I want to do this. And he said, my daughter she was 18 or 19 at that time. I don't remember her telling me what exact age she was. And I said, I'll send her. Imagine from Ambala to Bathinda, because Bathinda was kind of considered backward in those times. So he sent her to live in a hostel in school to teach girls science education. And my mom would always stand up to my grandfather, my future, her future father-in-law. She'll stand up for girls' rights, what they needed in the residency program or otherwise. And my grandfather really liked her strong will, right? So he kind of engineered in those times, although as you know, in India, I mean, in 50s and 60s, arranged marriages are today also a very accepted cultural norm. But in those times, thinking the quote unquote love marriage was kind of out of question, right? So he engineered that in between my parents. So he would have my father drop my mother off at the school after late meetings or events. So that's how they started liking each other and they got married. So I came into that context of family tradition of supporting women's rights, women's education, a robust environment for independent thinking. So that's how I was born in that family first. And then I grew up with a sort of open house sort of environment. At every given time, we would have like 30, 40 girls roaming about in our house. If they couldn't afford electricity, they couldn't afford fee, they needed help with their education. That's how they were there. In like mostly bachelors doing bachelors or doing masters, eating, cooking. It was like just like an open house, come, go, cook, whatever you do. So I grew up in that very thriving environment, community environment of support. I think that I didn't even learn reading as yet. And I heard my dad teaching Shakespeare, John Keats, and it's like talking about John Milton, the Paradise Lost, and thinking, what was he really thinking? Those kind of debates I heard growing up. It was that kind of environment that I grew up in.
That is great.
My family.
So you had very interesting, childhood as well as college life must be very interesting. It's really good to know about your grandparents and parents. And what about your education and journey as a clinician, public health specialist, and human rights lawyer? And what were the factors which influenced your choice for the kind of profession you are in?
So I think that I'm often asked, like, how are you a human rights lawyer and a medical a physician? How are you? So I am often asked, how do I balance two separate line of profession? I don't see it like that. So I see like my life, if you put the human rights and the justice, social justice and health rights as a spine, right? So I'm going to give you a metaphor on from medical, right? And the ribs are all my education and experience. The spine does not change, right? Whether I was an activist in graduate school or pre-med or medical school, it was always at the center was human rights, social justice, access to health, equality, equity, right? Everybody has rights to socioeconomic opportunities. civil political rights, freedom. So that was fine. So it developed very organically, right? So as you know, in India, the medical profession, especially now they have a little bit more wider view of good professions, right? Yeah. At that time when we were growing up, medical was like the top profession. So when you're a good student, you hear from your teachers, oh, she's going to become a doctor. So it's kind of an organic influence on mind. And plus, I think the most important thing was the noble profession. That's how we grew up thinking, looking at the doctors in the community who just picked their bag and went wherever and walked away without thinking of fee. So that is what was the most influencing factor, that you can serve without limitation. And in the most important field, saving lives. So that's how I became doctor. And human rights being at the center of the spine, I was doing a lot of investigating, reporting. I was involved in very strictly non-political human rights movement, right? Yeah, PUCL, People's Union for Civil Liberties, was a pioneer group. The parent group was founded by Jayaprakash Narayan, the very famous Gandhian. So I had the opportunity to sit with all those icons of our history, Justice Tarakunde, Justice Satchar, Supreme Court justices, and especially when there was political upheaval in India. So all these figures stepped out of their non-partisan comfort zone and jumped into activism. And I was very, very fortunate to sit with them and talk about these issues as a very young person. And that's how it became very ingrained in me. I served 16 years on National Council of PUCL with all these people that you just are at awe of, right? Justice Tarakunde is like, you can't go above that for his selfless Gandhian lifestyle that he had. So I ended up doing, bringing a public interest litigation in High Court. My very good friend and human rights lawyer, R.S. Baines, was the only one who agreed to do that case. I went to multiple lawyer friends and they say, this doesn't make sense. How can we, in future, ask for banning of torture instruments, right? Like rasa, rope, the electrocuting devices. You can't ask the court to go and say, there is a presumption and assumption that these instruments are used for torture, ban them. Anywhere found those instruments, it should be taken as that torture is happening in this police post. So nobody took it. And R.S. Baines said, okay, I'll help you get that, but you have to argue. So I ended up arguing with him in the High Court. And we got a stellar High Court judgment on it. And we asked for Punjab, but it got extended to Punjab, Haryana, and Chandigarh. And it became part of the curriculum of police training. And so that's how I developed the interest in lawyer legal sense. And then I was a full-time physician. I ended up doing the law and then got invited to apply for LLM at Notre Dame with full scholarship. So I said, okay, let me go and learn something from different perspective.
Right. It's interesting, actually. Wonderful. There are very few, doctors having a formal degree in law. There are very few doctors. Clinicians moving to public health is common. So I'm also ophthalmologist. I moved to public health. Major part of my life now revolves around public health. So that is common, but not that legal issues I don't deal. So thank you. And Dr. Sona, will you like to ask some questions?
Right. So I think wonderful, Dr. Vineeta. So it was really pleasant to listen about your dubious distinction about being a lawyer and a clinician and a public health practitioner. But I think what you spoke about, that you focused upon certain issues which are common to all those three things. And that's the thing you were talking about, the spine. So, and I can see in your background also that there are few things like about health equity, global health, you're working on partnership, you're working on human rights and maternal child health. So just want to know, because you are being considered as one of the champions of global health. And what are the things in global health or health equity which are right now important when we are seeing that there are a lot of non-communicable diseases, and now the COVID pandemic is there. So what are the immediate issues for us in public health to be tackled from the perspective or from the lens of health equity or from global health perspective?
Thank you. That's a very, very important question of the time. So thank you for asking that. Before I answer that question, I want to comment on your lawyer and the doctor thing. You know, when I went to Notre Dame, so, you know, the cultural differences, and that's part of learning, you know, cultural sense of humor is very peculiar to the culture. It is tied how you receive a joke, right? So when I was at Notre Dame, we were having this party at the international group, and somebody, my professor, it was my professor, he commented, he said, oh, so you're a doctor and a lawyer, so you can sue yourself, right? And I'm thinking, what is that? Like this, I didn't get the sense of humor at that time. I'm like, what? And later on, when I'm here for the last 20 years living in US, and now I retrospectively see, and so many people have said that same thing, and I get the humor in it. Now, after like 20 years, I get the humor in it. But anyway, so coming back to the more serious question of the issues of our time. So I think it's very complicated right now. How so? At different levels. One is that we are in a hand-to-mouth situation for many decades. We get this pandemic, we get another, it was HIV, it was this, and COVID, and there would be many others. So we respond to it. We are not getting ahead of them. So we invest way more money and resources and lose precious lives in responding to it rather than getting ahead of it. And that hits at the policy level, right? Like thinking about the policy level, how do we make it happen that we are a resilient, we have resilient, strong, sustainable, locally rooted systems, and we have policies to support the system so that this is not repeated. It's almost like we are going through the same thing, a deja vu, and losing people and lives. So I think this, for example, how many lives have lost in COVID, right? NCD, and I know you do great work on NCD. There are 70% of the global deaths happen due to NCD. Did they stop? No. Did they contribute to more deaths in COVID? Yes, right? About 40 million people die every year. Every year, 40 million, 41 million people die because of NCD. So I think that we are running in this vertical way. Tuberculosis, right? It's a respiratory disease which contribute to COVID and contribute, it's an underlying issue. 100 years old vaccine is still being used for tuberculosis.
Right.
COVID, we came up with 1 year. I'm happy for that. I'm very happy that we were. But at the same time, it's an opportunity for us as a global health, public health community to think, learn from this episode, and just make resolve that we can't have this circle going on.
Right.
Right. So the critical issues is what I'm hearing from the debates is, do we need new structures? Right? Can global fund, can Gavi, and can WHO, can they be evolved in a manner that they're stronger, they're more like teeth to work on things, right? So those are one thing. And I worry sometimes that we will come up with new fancy systems, something to global security or something like that, and make another parallel stream of resource investment and conflicting priorities. And again, keep working in the silos.
Right, right.
So one is at that level. How do we do at the global level that we learn from this system and see what was these existing mechanism could not fulfill?
Right.
And how can we fix it so that we are not drawing resources from one issue to another, but actually strengthening PHC. Health for all is like how old that's almost like a slogan.
Right, right.
Right? How do we end teeth to that? Right? Health equity was not in a word when we were working on access to health in 90s. It just, health equity word was more evolved in 90s, right? So are we going to come up with another fancy word and it's just, or look back and say, okay, we do have a mechanism. We do have a human rights framework. We do have health for all, right? How do we strengthen those? And so that's one issue. And the second big issue is, and I won't go into a lot more issues because it's a complicated scenario that we are dealing with. Another is resources. How are we going to, because COVID hit economies. Right now, we still have resources to mobilize. In coming few years, there is going to be a kind of a pull and push between domestic investments and global investments. Right. So that's another issue area that public health and global health people need to be thinking about. How do we clarify messaging? How do we make sure that in this pull and push, we are not losing this battle against all these epidemics?
Wonderful. I think you have raised a very important point, Dr. Vineeta, about like not having a vertical structure, but I think working for the overall global health. And we need not reinvent the wheel again. I think we have some systems already in place. We just need to strengthen those systems and I think work in a horizontal fashion rather than a vertical fashion.
Yes, absolutely. You're right.
Very nicely summarized, Dr. Vineeta. So maybe,
thank you.
Right. So I think only then we'll be able to tackle all these issues, and we need to think preemptively. Like we don't have to respond, but we need to think preemptively about the upcoming events or upcoming health-related conditions. And then I think we need to tackle before it comes rather than after it comes, which consumes a lot of money. So wonderful, Dr. Vineeta. So yeah. So Dr. Rakesh, do you want to ask?
Dr. Vineeta, we just went through some of your latest articles. So you talked about tuberculosis and COVID-19. And what are your views about this TB and COVID-19 vaccination equity? With the band-aid work on the chronic multi-system illness of global health disparities. And there's another article on COVID-19. How unprepared are we? Can you talk about these articles?
Yes. So thank you. It is kind of ties into each other. All three of them kind of ties into each other. I was traveling to Nigeria when COVID kind of hit, and I was there like just landed when there was first case in Nigeria was reported. I think it was 28th February 2020, and I had to revert back within like a day. And I came at airport, and it was totally. I called my family and said, you know, I might be delayed, but this is one time I'm not going to complain about delays because I want to keep everybody safe. If there's a screening, if there's a quarantine, whatever. And I was very sick. I felt very sick during the travel back. I tried to find anybody at the airport to see that there's a screening, there's a test, anything that I need to check. I had fever. I was, you know, kind of in a very precarious situation. Nothing. So I just walked out of the airport. And on the other hand, I'm hearing all these messaging from bilaterals and multilaterals and mechanisms and leaders like WHO. US is prepared. So I am thinking, even if I wasn't a physician, as a common person walking to the airport is telling me we're not prepared. How come all these multi-millions and billions of money invested organization? And that speaks to the core of how we are structuring these. How much the donor countries have influence on what they can say and what they cannot say. And that goes to the point we were discussing before. How do we give them teeth that they don't have to do that? If the US is a big donor, it's very much, I won't say understandable, because I know I have gotten into trouble for speaking truth to power too many times. So, but I can understand to some point that, of course, when it's a big donor, they might not be able to say, US, pull your socks. You're not prepared. So on one hand, I'm hearing that. On the other hand, I'm seeing as a lay person, even if I leave my medical background back, that we are not prepared. So that was my question posed, that how that tallies. And also reflecting on the previous question too, that made it very clear how the scientific leadership and the political leadership needs to behave or act or be independent or interconnected within these episodes, right? Whether it's a local domestic scientific and political leadership, or is it a WHO and the country level interventions, how they need to be independent to be able to be effective, right? So that was what I was talking about, and how prepared we are, posing a question to our community, our global health community, public health community. Are we prepared, or we are going to be soft pedaling this and lose lives? And it time proved. I was talking from a very superficial, personal, individual, experiential perspective. But then science proved that we were not, the numbers proved we were not prepared. How come those organizations missed? So that's what I talked about that. And it's in the deadly duo. So many people we lost in tuberculosis. You know it better than I do. I know that you work so deeply into that field. You know how many cases were missed in this whole resource shifting towards COVID, right? People were not traced due to different things, quarantine. There was a big impact on tuberculosis that we receded back in the goals, in the gains that we had for last decade on the tuberculosis. So what are we going to do now? Go back? So this whole, the left hand is working independently of the right hand, brain is going somewhere else. It's upon us, this generation and the next generations of public health and global health people, to force these difficult questions, right? The vertical approach versus having the, Dr. Sonu, what you were talking about, the horizontal bar, and how these vertical approaches fit into that horizontal bar and make it sense that we are utilizing these resources well, right? And it's not easy. It's not going to be easy because they're vested in trust, right? The control over money is a big vested in trust. So it's hard to get everybody together, and that's where partnerships come in. How do we recognize and understand everybody's aspirations and their own motivations and their own goals, and bring to a certain level? And I think that global pandemic, the unfortunate incidents, also brings us opportunity to convene that, because there's a new constituencies that are open to that sort of thinking.
So Dr. Vineeta, so I think we have all seen in recent times, so how unprepared we are actually. And we also seen how the political leadership has played a big role. Political as well as even the bureaucratic leadership, they have played a big role in containing the COVID, especially in India. And just a brief glimpse about your family, I'd like to know.
So I have a beautiful daughter, my only child, and she's light of my life. And my husband works for the government, Federal Aviation Administration. And we are three of us here living in Silver Spring, Maryland. And I find myself thanking God and the universe and the power above all of us for giving me the life that I have with this beautiful family. And I feel very fortunate. Every day I have gratitude for my friends, my coworkers, and all the people like you working so hard to make this world better for the next generation. And I see that I'm very well supported by my family to be able to travel so much. In my job for the last 20 years, I've been traveling at least 25% of the time globally. For a long period of times or many weeks. So I've been very fortunate to have that family.
Yeah. So Dr. Vineeta, I'm sure that you will show this informal talk to your daughter, and she'll be proud of you. So
Thank you.
Dr. So you can carry on.
So, Dr. Vineeta, I think it was really, really wonderful listening to you about a lot of things. And I think the young people or young public health specialists will be really motivated by the talk which you have given. And I think you talked about certain issues which are missing right now in the health systems, not only in India, but across globe. I think those systems need to be plugged. And I think you talked about certain things which about how the system should work, and what are the good things in system and how we can leverage them to better about various health related conditions which are grappling all over across globe. So, Dr. Vineeta, what are the key messages you want to give to young public health professionals who have just started degree or who are in the mid of their career to pursue public health?
So I have been working with young people for many, many years now, doing workshops on global health, policy advocacy. And I think I derive a lot of energy from them. I learn a lot from them when they ask questions, when they share their ideas. So one thing I would say, and I've been sharing this with young people for many years, is, and also I remind myself for every generation, it's a marathon that's structured like a relay race, right? So it's a long race, generational. Getting health equity or health for all, achieving that goal is a marathon. It's an intergenerational marathon. So not to get discouraged, in the face of such a magnitude, such a big magnitude of challenge, sometimes people get either overwhelmed in their, like when they start doing something and don't see the phenomenal, direct, visible change, they get discouraged. So I would say to view it like a relay race. All you can do is your best to your capacity. Whatever you can do best in that time of period, whatever it allows you to be contributing to the larger good of humanity, do the best and feel satisfied to pass the baton to the next generation, right? It's a long haul, and feel good about that. I did my best. And everybody's context is different. Some people can do different ways. Some can contribute different ways. All of us have a role to contribute. Whatever small or big it is, how it is your call, nobody else's call. So you can choose it, what I want to do, and just do your best and feel good about it.
Wonderful. So I think a wonderful message at the last you have given about do your best and pass the best. So I think that's the wonderful message you want to give. And really it was, I think, very encouraging listening to you about a lot of things which you have told about like COVID-19, about NCD, about our health systems, about being motivated in the profession, about being diverse in different professions, but I think stuck to the roots. So I think really wonderful listening to you. Dr. Rakesh?
So I think we must thank Dr. Vineeta for such a motivating informal talk with us, and for being with us for almost I'm close to 45 minutes with us. So thanks a lot, Dr. Vineeta. And now viewers will have some health news from Docplexus in the form of health minutes. Thank you.
Hello and welcome to Health Minute Highlights. The Central Drug Standard Control Organization, headed by the DCGI, has prepared regulatory guidelines for the fast-track approval of foreign-made COVID-19 vaccines in India. The guidelines were prepared based on the recommendations of the NEGVAC and were approved by the Union Government for quicker access to such foreign-made vaccines. The Gujarat High Court has pulled up the state government for the shortage of the antiviral drug remdesivir and the control on its supply. Due to the surge in COVID-19 cases, the court has ordered to make the medication available for all during this pandemic. Cardiogenic shock management is associated with several challenges, and a personalized treatment plan is highly recommended for managing such patients. In this regard, Docplexus has organized an interactive webinar where experts will discuss updates in interventional cardiology today at 6 p.m. Survival amidst the pandemic can be difficult for patients with hemophilia, not just in terms of physical and psychological health, but also with respect to the economic burden associated with it. This year, World Hemophilia Day intends to spread awareness regarding sustaining in this new world. Health Minute, the most liked segment of Docplexus, brings you the latest happenings in the medical field. Stay tuned for more insights. Happy Docplexing!